arm, we will go initially, screen, tell them that you have to follow diet, exercise, take medicine, refer them to the government hospital, and then see them. So intervention arm, monthly education and testing. Comparison arm, just initially and at 6 months. So this was a study like that, and very interestingly, you will see that in the intervention arm, the HbA1c came down by 8.8 to 8.2 only by the community health worker intervention. And if the control arm, what happened? It went up from 8.7 to 9.66. In other words, a simple community health worker based intervention without any GLP-1 or some expensive insulin or some expensive SGLT2 tablet, without anything, just basic minimum medicines and diet can bring down that community's HbA1c from 8.79 to 8.2. And that result told us that we are onto something. And you can see that this was also reflected in LDL cholesterol. So we found that this project, which is called Project Diabetes with Dignity Intervention, is especially effective in reducing HbA1c in people with diabetes in the intervention group, and capacity building of community health workers is key. After this, we approached the Maharashtra government and told them that we have this project, these are the results. They took it on. See, we don't have to do everything. Once we run our community project and show the results, they took it on. They said, we will do it. Give us your training materials. And we have shared it with everybody. In fact, we can share it with you also. We translate it into Marathi and we can share it with everybody. And this community intervention has been now taken up by the Maharashtra government. And as I mentioned, they have used all our materials, reading materials, our programs. So even the PHCs where we did capacity building, one day of the week, the PHC made it as a diabetes day, diabetes clinic day, and they had we made a separate book for them, how to monitor the sugars. And this made sure that the PHC was empowered. In order to close the loop, we also met all the private practitioners of the city, of the villages, and we trained them also, because not every patient will go to PHC. So in the intervention arm, our community health workers went house to house. Capacity building was done at the PHC. We also trained all the local doctors. Then we saw the outcome versus the comparator group, and as we said, we found the A1C came down. This project was very much liked by people, and want to thank many people. Dr. Damodar Bachchani from the ministry at that time, Professor Nikhil Tandon, Dr. Srinath Reddy of the Public Health Foundation of India, Dr. Sadhana Taide, who was in the government Arogya Bhavan, and this helped us to work on the next project, which was childhood obesity prevention, where we did school programs. Many of us also, you also know that we have tried to reach out to patients in our magazine Diabetes Health, which is now in its 12th year. There are many magazines for diabetes, but our magazine has stood the test of time and is continuing, and this is the end. So these are some of the new projects we have undertaken at the Chalaram Diabetes Institute, and this is Chandu Champion, one of the heroes who worked served India, and they came. And we also tried to build a local community through our wellness center, where the local population around where we stay are empowered in diet, exercise, physical activity. This is the new project that we are coming up, and this project and our newer mobile clinic goes beyond diabetes. We look at women's health, breast cancer, and screening for women's health, and that is our new program, and that is coming up in our new building. And as I said, it's not the village people who work hard anymore. Sometimes even we have to work hard. You can see me, inaugurating, though I do only that. We as doctors don't have to do other things. So friends, on that note, I've talked about diabetes management in India, of how diabetes is there in the villages, how people suffer in those villages. Second, I discussed our experience in the community, how we found that there was a man with diabetes who had foot amputation, toe amputation. He tied up with a socks and he was walking. How a child did not even have insulin to take in the remote villages. And I talked about those real life stories. And third, I talked about how we, at least I call it the Pune model. Pune is known for many types of research, but I call it as a Pune model, where we are able to capacity build community health workers, and that made a huge impression in diabetes. And I showed you a comparison of the two sets of villages, the intervention village and the control village, and how a simple intervention of monthly visits by ASHA workers can dramatically change the A1C. So before I end, I want to thank all the institutions I worked and studied in. In my school, I studied in Chinmaya Mission School, and Swami Chinmayananda, he was one of the people I looked up to in my childhood. Then I studied at the Kozhikode, the Calicut Medical College, and I met one of my juniors here who's actually here, 5 years junior to me. I spent a lot of time at the Amrita Institute of Medical Sciences as a professor. I want to thank that institution. I see at least two of my diabetology trainees are here in the audience, and they are practicing and very successful. One of them has raised their hands. Dr. Gauri is here, and the other is of course Dr. Ramesh, and happy to see them all very successful. Ramesh is here, all doing from Dindigal, all successful diabetologists, and that gives us happiness as well. I want to thank Amma, because Amma's grace is something which has showered on me throughout the years, and for 3 generations we are devotees of Swami Satya Sai Baba. I'm a Balvika student, and I want to thank all these people, including my family, who have made me what I am, and of course all of you, because I may be able to talk, but unless I can share it with doctors here, each one of you here, only then that gives me happiness, that carries the message, and that we get the feeling as we doctors can get together and build something. I also want to thank all the institutions we work with, the CSIR NCL Pune, the Ministry of Health and Family Welfare, the Maharashtra Arogya Bhavan, the Public Health Foundation of India, the Zilla Parishad, as we embark on our 3rd program, and also the members of the Chalaram Diabetes Hospital. This is our cath lab, our dialysis unit, and of course our expansion plans are in progress. Friends, it's a pleasure to give this oration. It's an honor for me, and I enjoyed myself thoroughly and felt touched at this honor bestowed on me. I thank you very much, and thank you for inviting me here.
This oration deserves a standing ovation. Thank you, Dr. Unikishan, for that excellent oration. And it is really surprising and heartening to see how a consultant endocrinologist can do so much of community service to the people of the nation. Thank you for that, sir. Thank you.
Thank you, Dr. Uni. Yeah, we are honored to have you here, and we are delighted and to see all your achievements. Probably we will, all the RSSDI members of various positions can just try to be in touch with you and try to imbibe something from what